And I'm gonna look.
So this is what normal bladder tissue looks like.
Yeah.
All that nice and smooth. I don't see any kind of lesions there. And then I'm going to flip the scope over, probably be able to see this a little bit better. You see that?
Yeah.
That's your bladder tumor.
Beautiful.
Kind of looks like a fleshy cauliflower.
Kind of looks like something on a coral reef.
Mm-hmm.
And it's probably just on a stalk.
That's what I was wondering, if there's any way to tell how big, because they said it was polypoid, but nobody told me. I'm like, okay, how big is the stalk?
You shave it out with a resectoscope. I'm going to try to come across it again here.
Yeah, so I know it's been growing at least 8 months.
Just trying to bleed again there.
Mm-hmm.
It's not that bad.
Really?
I wouldn't shit you. You're my new favorite turd.
It totally looks like a sea coral.
Yeah. Well, that's it.
Yeah, and I know I've had it. The first bleeding was 8 months ago. And then I went to that urologist, and he was like, oh, yeah, you should have had this done 8 months ago. And I'm like, talked to another urologist this morning on the phone, and he's like, women often get passed off as, oh, it's an infant. Yeah. And since I have EDS and we have fragile bladders, they're like, well, that's...
Is it gray one or the white one? I'm not sure which one it is.
We'll see.
Yeah. There you go. Mm-hmm.
Okay. All right, that's pretty simple. Looks like it's on the surface, superficial urothelial carcinoma.
You don't think it's, so is it like transitional cell?
Yes, I do.
So
They used to call it TCC, or transitional cell carcinoma, but then the nomenclature was changed about 8 or 10 years ago. It's called urothelial carcinoma. What's important and that I don't know are two things. The grade of it, is it low grade or high grade?
Right.
Which has to do with nuclear atypia or disorganization.
Right.
And the more disorganized, the more aggressive they behave, or more likely to recur. And the most important thing that I don't know, the second thing, is how deep does it invade?
Does it go into the muscle wall?
Yeah, it looks like a superficial bladder cancer to me. So that...
maybe it goes in the lamina propria, maybe it's only just in the...
Correct.
Yeah.
But you don't know until you shave it out and you got muscle tissue in the specimen.
And so, I know some people do chemo. I understand that BCG is, the best one, but very hard to get right now. Do y'all...
No, we get it.
Y'all get it?
You just have to stockpile it. They give you two doses a month or something like that, and we just keep on stockpiling it. Not everybody's... People aren't on it all the time, continuously. People that need it, they'll get 6 weeks worth once a week for 6 weeks. Some people are on maintenance, but the maintenance is 3 weeks every 6 months. But this may not even need that. I don't think it's going to require that.
Gotcha. Well, and I'm already doing, and I know people say it's, there are scientific studies on the whole ivermectin fenbendazole for tumors, and I'm currently taking that.
That's fine.
And N-acetylcysteine, alpha-lipoic acid,
we'll just give it credit if you get cured.
Well, and I'm interested in seeing whether it shrinks before the next, since I'll be gone, because...
It's not going to change a lot in the next 2 weeks or 3 weeks or month. But
gotcha.
Here's the last question for you. Do you want me to take care of it?
Not that other guy, I like you much better. You're talking to me.
So let's pick a date now for when you get back from your trip.
Gotcha.
Okay? You're not going to go from organ confined disease to metastatic disease in that amount of time.
Gotcha. And the other question I had, because of course he looks at and I brought my discs with the CT. I also sent on the portal, I sent you pictures where I got to the right level and just took screenshots and measurements, although I switched it to inches because people don't understand millimeters and centimeters.
Yeah.
But, what was I saying?
I don't think that's 4 centimeters.
Okay.
I think it's maybe 2.
Gotcha. Well, that's good. That's why another reason I wanted
And I
to.
think where it's attached to the bladder wall is probably only about 1 centimeter at most.
Gotcha.
It's just gonna be like like that tree on your shirt. It'll come down to a stalk, and the tumor may be this big, but where it's attached to the bladder is about that big.
That's what I was wondering, because you couldn't really tell. And on that, there was one question I was going to ask you when I started saying, oh, I did send you the CT pictures and everything, and I brought the disc if you want it, if you want to download it, whatever. But
okay, where was it done?
it was done in American Imaging.
Okay,
The one
I
on
can
Baxter.
access that.
Okay.
And look at it.
I just got it because I wanted to look at
Yeah.
it, and that's me. So I took a bunch of screenshots. I actually posted the screenshots to the portal just because.
So it didn't, if my memory's correct, it didn't show any enlarged lymph nodes.
Oh yeah, that's what I was going to say. He put no evidence of metastasis, but that was my other question. What about like doing a PET scan for glucose uptake to actually determine if it appears that there's any enhanced glucose uptake in my lymph nodes? Do you recommend doing that?
No.
No? Because I was kind of like, if it's in all my lymph nodes, then,
So here's the thing: is you understand probably better than the average person that there is no perfect test.
Oh, yeah. No, I know.
Every test has like its limitations of what its resolution rate is,
Right.
what it can see. What it can't, those kind of tests can't see is micrometastatic disease.
Gotcha.
So if it was muscle invasive, if it looked like what it does now and it just happened to be muscle invasive disease, there's a 25% chance that you would have micrometastatic disease in the lymph nodes. It wouldn't even show up on a CT scan. This is like...
What about like a PET scan where they do the glucose uptake?
Again, that has a resolution rate. It's going to be we can do it. We can do it for your...
Well, that's the thing. We can give me more radiation, and I have to balance that, having had all my joints radiated.
It's not
a
really
million
radiation.
times.
A PET scan's not radiation.
Oh, okay. I know it's positron emission, but
right,
I thought it still gave you some... I don't know. I read something that they're like, it's like 200 CTs and that the number of chest x-rays that it's equal to. So it's not radiation.
It is radiation. It's a form of radiation, but you get more radiation looking at your phone today than you will from a positron emission topography test.
Gotcha.
So
what's
important is it what they attach a isotope that has a beacon of radiation that delivers is radioactive,
but different than the iodine that uptake.
Correct. It's not contrast. It's not iodinated contrast. So you got this radioactive isotope, and it's attached to a ligand that is involved in metabolic sugar metabolism. Yeah. And it goes to it gets concentrated in areas of high metabolic turnover or high sugar turnover. Well, and so neoplasia has high metabolic activity.
That's why I was wondering if it would show that in my lymph nodes.
That's where it would show up. But it's got to be at a certain level of activity before it's actually going to turn positive.
And you don't think it would show up in my lymph nodes?
I don't think so.
Okay.
So that's probably why it's not a standard screening tool or staging tool for bladder cancer.
Gotcha. I mean, the only staging and grading seems to be surgery.
Yes.
Okay.
But that tumor-based... I'm going to tell you what I think, but what I think is not always correct.
Well, right.
I can't predict the future.
Yeah.
But 30 years of experience of seeing these tumors, it looks like to me it's just on the surface. It's going to come back a low-grade urothelial papillary carcinoma, or a papillary urothelial carcinoma low grade, and just resecting it is probably the only treatment you're going to require.
Gotcha. And then we'll just see if it recurs, because most of them do.
It's got about a 30% chance of coming back, so you get on a surveillance cystoscopy schedule.
And it doesn't necessarily come back in the same spot, from what I understand, because it's bathing your bladder.
It's a field change disease. 98% of the time it's going to recur in the bladder. There's a 2% chance it's going to show up in your upper tracts, from your ureters up to your kidneys.
Yeah. Okay, gotcha. Because it's whatever's toxic in my urine that's doing it, which partly is smoking and partly is the shit in our food, or the lack of vitamins in our food, and all the pesticides and the everything that gives everybody cancer that we didn't have a couple hundred years ago.
Things that we really can't control.
Yeah.
So I mean, I got a young man. He's like, I think he was like 38, younger than that, maybe 32. Very healthy, very fit, eats very well, never smoked, never drank, blah blah blah. He had a baseball-sized tumor in his bladder.
Wow, that'd be taking up a lot of space. It makes sense why I have to pee more often now, because I don't have so much space.
It irritates it. So it irritates the wall of the bladder, so it triggers like bladder contraction, and that's what causes urgency, and then that's what makes you feel like you got to go.
Gotcha.
All right. Have a great
Thank you
trip.
so much.
Schedule this. Good. I'm glad you did. Schedule this when you
for when I get back.
Right, for when you get back.
Okay.
And we'll have it on the book, so there's no more delay. And when I do this, I'm going to squirt dye from your bladder to your kidneys, just to kind of verify there's no lesions in the kidneys that didn't get missed on the CT scan.
Okay.
Does she have a catheter for there?
No, you're not going to require a catheter.
Cool.
That's good.
Yay. And what are the pills?
That's the Keflex and then Pretium.
What's that?
AZ.
Huh?
AZ.
What is AZO?
You never taken AZ for UTI?
No.
So it makes
Peridium?
Pretium. It makes your urine bright orange. So
No.
that's
Is it a similar thing like drinking cranberry juice? I was just wondering its mechanism of action.
So,
It's got several different things in it, but the main mechanism of action, well, one of them is like a smooth muscle relaxing agent, Levsin. Phenazopyridine is like a anesthetic for the lining of the bladder.
Gotcha.
But the exact mechanism I couldn't tell you, because I'm stupid.
And thanks for giving me Keflex and that. Even though it's just one with EDS, I'm not doing fluoroquinolones. I know too many people that's like a contraindication. I recorded that.